When it comes to the topic of weight loss, a lot of people have very unrealistic expectations. These unrealistic expectations not only set us up for failure because we get a little bit depressed when we don't hit certain results or hit certain goals, but the other thing about it is we have to understand that the weight didn't come on overnight and is not going to go away overnight. And so that's why in this video, I want to really teach you some of the things that are going to slow down weight loss, speed up weight loss, some of the things that we can really expect to see when it comes to our weight loss goals. And then of course, at the end of this video, I'll teach you the exact steps you need to take in order to successfully achieve good, healthy weight loss. So stick around to the end, but before we get started, I'm Dr. Zyrowski and welcome to the channel. If you're new to the channel, it's a pleasure to have you here. Be sure to subscribe, hit that notification bell, and join our notification community so I can help you excel your health and your life. Now, I also want to mention at the release of this video, my Precision Nutrition program is open. This is a program that I only open up a couple times a year, and it's only open for about 7 days, okay? Now, this program is a one-on-one health consulting program where we do blood work, we figure out your baseline health, and we help you not only reverse health conditions and reverse so many symptoms that you may be facing, but also really achieve excellent health. If you want to learn more about that, click on the link in the description below. Let's go ahead and talk about how you can have some realistic expectations when it comes to weight loss. Because, you know, when we think of weight loss, there's so many different ideologies behind it, right? There's the calories in, calories out. You burn 3,500 calories, you lose a pound of weight. You calorie deficit, 3,500 calories, then you lose a pound of weight. But it's not quite that easy. And there's so many differentiating factors. Let's talk about a couple of them. Now, first of all, your starting point is a big deal. How are you showing up to the gate, okay? Everybody shows up to the gate a little bit differently when it comes to weight loss. Now, let's talk about a couple of these things to look out for. Age is a big one. What we see in the research is that as we age, our metabolism can slow down between 20 and 25%, okay? That's a big deal. So once we start hitting 60 years old, 7 years old, our metabolism is going to change. It's going to slow down. If you're someone who is a little bit up there in age, then you're going to find that it's a little bit harder to lose weight. I mean, anybody can tell you that, wow, you know, when I hit 30, things change. When I hit 40, it changed again. And then from there on out. So we have to take our age into consideration, right? Because we so often compare ourselves to the person next to us, or we compare ourselves to somebody who's not like us at all when it comes to weight loss. And we get frustrated and then we want to quit. Now, the next thing is we have to understand our weight. Our starting weight is a big deal. If you're somebody who's obese, if you're somebody who has a lot of weight to lose, then you'll lose weight pretty quickly. It'll happen fast, right? But then, of course, once you get down to those last 30, the last 20, even 10 pounds, it starts to become a little more difficult, a little bit more challenging. You got to kind of dial in your focus a little bit more. And so that's what you have to understand too. Whatever you're showing up to the gate with, as far as weight, it will change quite a bit. Sometimes we see people who maybe are obese and it's like, wow, they lost 30 pounds in 6 months. And you're like, I can't even lose 10 pounds in 6 months. And the truth is, it's just different based on how much weight you're trying to lose. It's always easier when you have a lot and harder when you have a little. Next is going to be gender, okay? Male versus female. A lot of times, maybe a husband compares themselves to the wife or vice versa. And the truth is that it's very different from one individual to the next. What the research shows is that men will actually burn far more calories throughout the day. And there was one research study out there that showed when men and women were given similar diets, the men were actually able to lose the weight 16% faster than the women. So it's something we have to take into consideration. As a female, you're going to lose weight a little bit slower than a male typically will. So take that into consideration. And let's talk about what happens if your weight loss stalls, okay? Maybe you started losing some weight, you're real happy with your results, it stalled altogether. Now, there's a couple things that we have to look at. First of all, sleep can be a big factor. There was a study where they took people and they sleep deprived them and then they tried to lose weight. And then they took the other group of people and they were able to get a sufficient amount of sleep at night. The people who were getting the sufficient amount of sleep were able to lose weight 55% faster than those who were sleep deprived. And so anyway, sleep's a factor, stress is a factor. Are you on some sort of medication? Okay, this is a big deal. A lot of medications out there can cause you to gain weight or even not lose it very quickly. And then are you suffering from an underlying condition? Okay, this is a big one. If you are at a starting point and let's say you have insulin resistance, you want to start losing weight and you have the person over here who doesn't, guess who's going to lose weight much faster? The person who doesn't have it. What if you have a thyroid condition? What if you have just hormone imbalance? What if you have some other condition that's slowing down weight loss, okay? So we have to understand when it comes to weight loss, we have to have very realistic expectations. And we really should focus on this, okay? This is a big thing that I work on with my patients is we kind of forget this whole weight loss thing. You know, people come to me all the time and they say, I want to lose 20 pounds, 30 pounds. And it's like, well, let's focus on getting you healthy, right? Because if you have 30 pounds to lose, or if you have 50 pounds to lose, there's a good chance you probably have some insulin resistance issues. So let's focus on insulin resistance. Let's actually focus on the real health goals, okay? Let's kind of put the weight loss thing aside and focus on the real problems at hand. Because if we focus on our real health problems, then the weight loss is going to be a really nice byproduct. So here's how I recommend the order in which many people should approach losing weight. Okay, first of all is figure out what your health goals are. Start thinking about that. Do you have insulin resistance? Do you have fatty liver that you need to reverse? Are you suffering from an inflammatory condition? Do you have thyroid imbalance? I mean, do you have some issues that you want to start focusing on? That should be the focus, okay? And so figure out those goals in your head. And now from there, let's focus on diet, okay? This is really important because we can't skip this one. You need to be following a good, healthy diet. You got to get rid of the sweets. You got to get rid of the sugar. You have to make sure that you're getting rid of all the processed food. Focus on eating a good, healthy diet. Maybe it's the ketogenic diet. Maybe it's just a good, healthy, whole food, low carb diet. What research shows is that when it comes to weight loss, the ketogenic diet and low carb diet are some of the best diets that you can follow, because not only does it help stave off hunger, so you don't have a whole bunch of hunger problems like those people who are eating really unhealthy and calorie restricting. You are not only eating good nourishing food, you don't have hunger problems, and then you're losing that weight, okay? So focus on diet next. And those diets are very good. They're anti-inflammatory. They help you heal. They help you balance your immune system. Very powerful. So you have your goals in mind, then you clean up your diet and get this straightened out right here. Now let's say that you're trying to lose weight and you've done that. You had your goals in mind, you're working towards that. Then you're eating the proper diet. Then you should do intermittent fasting, okay? Intermittent fasting is something that's so easy to integrate into your daily life. It helps mobilize those fatty acids so that you can start burning them while you're in that fasted state. And it's just something that's a no-brainer. Do 16 and 8, do maybe a 1 meal a day, whatever is best for you. Start using intermittent fasting in order to help with weight loss. And then lastly is going to be calories, okay? Now let's say that your goals are in mind, your diet's right, you're doing intermittent fasting, and you still have a little bit of weight that you're trying to lose. Now we want to talk about calories, okay? Maybe you're overconsuming. You can follow the ketogenic diet and still overconsume calories. You can follow a low carb diet and overconsume calories and not be able to lose weight. Okay, so we want to make sure that we do it in this order. This is very important because some people start here and they're eating a very unhealthy diet, living a very unhealthy lifestyle. They start cutting calories. They're hungry all the time. They're miserable all the time, and they're becoming more unhealthy. They're cutting calories to a point where they're actually destroying their metabolism, and then it's just not the right way to go about it. So we don't want to start here. We don't want to, let's say, just start with intermittent fasting. Let's say you don't care about eating a healthy diet and you heard that intermittent fasting can help you lose weight. So let's say you're doing 1 meal a day, or you're just trying to, put all your meals in this tiny little eating frame. But the truth is that that's not going to work either. Okay, we really have to just take this 1, 2, 3, 4 step, and we have to make sure that we're taking a realistic approach to weight loss in a healthy way. We don't want to be one of those people who's eating shakes every day, or just drinking shakes every day and doing a weight loss in a very unhealthy way. We don't want to be the people who are intermittent fasting and putting all their meals into a tiny eating window where they're not eating healthy, they have a whole bunch of health problems. We really want to focus on the health goals and work our way down this list, and as a result, you'll start to lose weight. Now, it's very unrealistic to think that somebody who just has a couple pounds to lose is going to start losing weight extremely rapidly. We want to make sure that we understand this, and that, losing a pound a week or 2 pounds a week, or, maybe a pound every other week is going to be perfectly fine if we really focus on our health goals and that weight starts coming off at that pace. Then that is a good, healthy pace for us. So whatever it is, focus on these goals, allow the weight loss to happen, and then if you need to, go down to counting your calories. That's going to be the way to achieve good weight loss. Give this video a thumbs up and check out this video over here if you want to learn more about how to lose weight. As a result, you automatically intermittent fasted, you pushed your body to start burning fat, you raised growth hormone, you really dropped down your blood sugar, dropped down the fat storing hormones, and it really is helpful.